I am sitting here today with Louise. And Louise, you came to me 1 year ago, and you have a rather complex background, but you had a lot of leg pain, knee pain, ankle pain. We determined that you have arthritis of your knee and also of your ankle and some vascular abnormalities. And at that time, we did bone marrow stem cells into your knee, into your ankle, and into your calf to help with the circulation. And please tell me a little bit about your condition and then what your pain was like before the treatment and then how you've been this last year.
Yes, I'll be happy to. I'm Louise, and I was born with a very complicated underlying condition, Klippel-Trenaunay Syndrome, which is a vascular malformation. So I've had many surgeries on my leg, 30 in all, just on my leg. Orthopedic surgery to correct leg length, and vein strippings, a lot of vein strippings, also sclerotherapy, and I'm also I was a long distance endurance horse rider. So I've had injuries sustained from horse riding, including a very bad break in Africa in '98, where they had to rebuild my ankle joint. So I had pins and plates in it that triggered 3 life-threatening infections. They didn't never think I would have an ankle again, but a doctor in Los Angeles was able to rebuild me a joint. But and then I had the pins and plates out, but with 1 remaining pin. But I've developed very bad arthritis in my ankle, along with my vascular condition, and also in my knee. And I went to see a traditional doctor, orthopedic surgeon who specializes in knees, and he wanted to give me a complete knee replacement. Then talking to my vascular surgeon and my family doctor and other people who know me just said, absolutely, I can't do that. If you open up my leg, I could bleed out, get another severe infection, I could just die from that. And it's worth putting up with the pain. And so I was very limited in what I could do, both hiking and horse riding and any twisting, turning motions. So I was actually seeing a nutritionalist down in Midway, and they referred me to Dr. Adelson. And I came in here, and he said he could help me, and I was skeptical at the time, but I decided that I should take the risk. It was not a comfortable experience, but I had bone marrow taken from my hip, and then, as Dr. Harry said, put in my ankle, my calf, and my knee. And I didn't feel immediate results, but after probably about a month or a month and a half, I was riding and doing a particular gait on the horse, trotting actually downhill, and I realized I was feeling not much pain at all, if any. And then I was having very severe cramping in my calf when I was riding. And I realized that I wasn't getting that anymore. And also it helped my pain in my ankle. So it didn't last forever. That's why I'm back now. And Dr. Harry had said that it probably wouldn't last. It's a temporary fix, but that he explained the whole procedure and that it grows new stem cells. And so I'm back for more.
That's great. That's great.
Yeah,
so
really
if you had to pick a percentage improvement you had sort of at the height of your improvement, what would you say you had?
Oh, at the height of my improvement, I would say I always have some pain, but I would say it was 80 to 90%.
Oh, that's great.
Improvement. Yep.
Great.
And now I'm kind of back to, feeling the sharp pain and the twisting motions and everything, and my ankle's bad again. So I'm not quite as bad as I was before, but I'm definitely feeling like I need to get the treatment again.
Well, let's do another one and see if we get 2 years this time. Super. Thank you so much.